Greetings and thank you for joining me for this last section of the respiratory system that we're going to talk about today. We're going to talk about breathing mechanics part 2, which includes gas transport and the effects aging has on your body. So at the end of this video, end of this lesson, my goal is for you to be able to differentiate between alveolar ventilation and minute ventilation. Minute and alveolar ventilations. You'll identify where breathing is controlled in the brain and how or why we breathe and know when to breathe. We're going to talk about how oxygen is carried by the blood. We're going to describe the respiratory system changes as you age. So as you get older, what happens to your body in the respiratory system in terms of that. So here we go. For starters, we have this term called minute ventilation. So minute ventilation involves the amount of air that you breathe in a minute. And so the way you do this is you count the number of respiration cycles in 1 minute. So breathe in, breathe out is 1. Breathe in, breathe out is 2. So start a clock, time yourself for a minute, count the number of breaths in, number of breaths out. Maybe have somebody else time you. So you just relax and breathe and focus on counting the breaths. If each breath is 500 milliliters of air, which is average, what is your minute ventilation? And so you will multiply this. Each breath is 500 times your number of breaths. That's your minute ventilation. If 150 milliliters of alveolar space is called dead space that can't be exchanged, your residual volume, what would your new alveolar ventilation be? Okay, so minute ventilation is just 500 times your number of breaths, which is pretty straightforward in a minute. If we subtract this dead space, this alveolar dead space, which is 150 milliliters of air, this volume can't be exchanged. We can calculate then our alveolar ventilation. So per breath, if we lose 150 milliliters of air, that would be our alveolar ventilation there. Okay, so your breathing is controlled by your medulla oblongata, which is a portion of the brain, which is shown here. So your medulla is this kind of this enlarged portion of your brain stem down here. This controls your breathing. And this is why, if you are quote unquote brain dead, you can be kept alive because this controls your breathing. All of your function up here, everything that this part of the brain does can be gone. As long as this is intact, you keep breathing, you survive. And this is how you were kept alive. And so the way your medulla works is it works with these things called chemoreceptors. And your chemoreceptors measure your oxygen levels in the blood. And so when your oxygen levels are low, your tidal volume and your breathing rate will go up to increase the amount of oxygen that your body is getting. And actually, I think a lot of times your body focuses on carbon dioxide concentrations and not oxygen. And that's why it used to be before they purified the gas in cars, you could die of, and you still can, die of carbon monoxide poisoning easier because carbon monoxide takes up the same spot on a red blood cell that oxygen does, only it doesn't get released. And so you have a decrease in oxygen levels, and because your oxygen is low, but your carbon dioxide isn't being produced, your body doesn't know that it's not getting the oxygen it needs. And that's why you can die from carbon monoxide poisoning without even realizing it. So back to your lungs. Your lungs have these things called alveoli, which are pores. These are the small little sacs that gas exchange happens in. These alveoli have pores, which allows oxygen to flow between your alveoli, and this allows the maximum amount to be absorbed and transported into the blood, or diffused into the blood. Okay, so again, you have these pores. Your alveoli are just covered in blood vessels. All these capillaries surround your alveoli, and the walls are thin between both the alveoli and the blood vessels, and so the whole reason is to get the oxygen into the blood cells. And so you see all these blood vessels here surrounding your alveoli, and so the oxygen can diffuse into any of these. Carbon dioxide can diffuse the opposite way, into all of those. That is how your gas exchange and your breathing works. Okay. Now, when it gets to the blood, most of 98% of your oxygen attaches to this thing called hemoglobin, which we talked about, which has iron, which carries oxygen. As the pressure in your tissues decreases, oxygen pressure decreases, meaning your tissues have less oxygen. Your oxygen goes from the hemoglobin to the tissues, diffuses from high to low. Carbon dioxide works the opposite. If you have a lot of carbon dioxide in the tissues, it's going to diffuse to your red blood cells to be removed from the body. So it equals out the pressure differences there. And this is why you get more oxygen to your skeletal muscles during exercise, because of this pressure difference. So you have less oxygen in your tissues when you're exercising, so you need to get more, so you release more of it there. That's your body's feedback loop to keep it alive and allow it to do what it's trying to do. Okay, so here is a gas transport pressure curve. So this is looking at your percent of hemoglobin that's saturated, along with your oxygen partial pressures at 38 degrees Celsius, which is our body temperature. Okay? And so you will notice that once you get up to roughly 90, even 100 millimeters of mercury pressure, you're almost fully saturated as far as hemoglobin being saturated in blood. So the partial pressure of oxygen needs to be roughly that high, and you can saturate your red blood cells and get the most oxygen possible to your lungs. Okay, here's another look at it. And so this is a capillary going off. This is your blood partial pressure of oxygen is 95, which allows most of it to diffuse out, which is what we were talking about. You have blood coming from the body. Whoops. You have blood coming from the body here, and it doesn't have oxygen, and here's where that transport happens. So it releases the carbon dioxide, absorbs the oxygen, and then continues on its way. When it gets to the tissues, your tissue pressure is 40 millimeters of mercury. So again, it goes from high here to low here. And then carbon dioxide would be the opposite. It would be high on this side, low in your blood, and it flips that way. So it's all based on pressure changes in your bloodstream and in the cells of your body. Okay, the last little bit we're going to talk about is how your respiratory system changes with age. And so as you get older, as you age, some different things happen. One, because you've lived longer, you've breathed more air, you have an increased exposure to pollutants. So you've experienced more pollutants, your body has absorbed and handled more pollutants, so you have an increased chance of bronchitis, cancer, and emphysema. Okay, these are all happen as you get older, just because your body is beginning to be worn out. You have cilia. So we talked about cilia in the nasal cavity, cilia in your trachea, which protect you, which removes those pollutants. Your number of cilia decreases with age, making the removal of mucus and the filtering of particles a little bit more difficult, less efficient. The cartilage in your trachea and your ribs begin to calcify, and as that cartilage calcifies, it's not as flexible. So especially the cartilage in your ribs that help to pull your ribs up and out and allow you to breathe in more air, it begins to calcify, so your ribs don't expand as much. So you can't breathe as deeply, and you can't bring in that same amount of oxygen. Okay, and then the last little bit, the last kind of side effect of aging, as far as the respiratory system is concerned, is your number of alveoli decreases from, again, that 300 million number down to 25 million. Okay, so 1/12 what it was when you were young and in your prime. And so because you have only 1/12 of the alveoli there to allow gas exchange to take place, you just can't transport oxygen as efficiently. It's harder for you to get oxygen to your blood and to your body's cells. So those are some of the effects of aging. You'll need to be familiar with those for your assessment coming up. For now, this is the last slide of the lesson, of the unit. So read through these questions, make sure you can answer them, have an idea about them. If you have questions on anything we've talked about thus far, make sure you ask when you return to school. Otherwise, I look forward to continuing this unit with you, finishing things up, and moving on in the semester. But thank you for your time and attention. Enjoy the rest of your day, and I will see you next time.